Hello, I'm Dr. Jerrold Weinberg. I'm an obstetrician gynecologist, and for the past 15 years I've concentrated my practice primarily on the diagnosis and treatment of menopause. Menopause means a cessation of menses, meaning your period stop, but it's really a process. The process is the estrogen level in the bloodstream gradually starts to drop, usually when a woman is in her late 40s. As it drops, her periods become irregular and she starts to get some symptoms, hot flashes, night sweats, things like that. One of the things that happens to women at the time of menopause is that they start to get emotional changes, which are very frightening. Besides what some women experience as depression, there can be anxiety, palpitations, perspiration, those sorts of things. Women start to have difficulty concentrating, which they call brain fog. Libido tends to drop. We explained that the profound changes are due to the drop in 17-beta estradiol, which is the major female hormone that she has been making since she went through puberty. So she's been making that hormone for almost 40 years. All of a sudden, when the level of estradiol starts to drop in her bloodstream, she gets all these symptoms. It's almost as if these various organs in her body are crying out for the estrogen. The answer, of course, is to replace the estrogen. The important thing is we use exactly the same hormone that her body has been making. That's what we mean by the phrase bioidentical. So she's been making 17-beta estradiol, and that's exactly what we give her. It happens to be derived from soy, but that's what it is. When a woman has not had a hysterectomy, she also needs natural progesterone because progesterone protects the lining of the uterus from the estrogen. Progesterone comes from yams. This is not an artificial substance coming into your system. What's it going to do to me? How am I going to be different? We're just restoring exactly what you were making. If somebody took out your thyroid gland and said, I'm going to give you thyroid hormones, you'd say, of course. And that's all we're doing, is we're restoring your own health. So when women come in with severe menopausal symptoms, I just reassure them that in a few weeks you're going to be exactly like you were before you started having all these symptoms.
Hi, I'm Mimi Kuykendall, a physician assistant as well as a certified menopause practitioner, and I work with Dr. Jerrold Weinberg at the Birmingham Menopause Institute. And one of my roles as a physician assistant is to focus on patient education. And one of the ways that I do that are with Menopause Consults, which I sit and talk with new patients for about 45 minutes on the whole process of menopause and the various treatment options. And that includes doing a comprehensive health assessment where we would go into detail about any cardiovascular or bone or other health issues. One of the other services that I provide is performing comprehensive physical exams for those women who don't want to see perhaps a male practitioner. And that would include the annual GYN exams and any other problem-focused office visits, as well as prescribing medications, including bioidentical hormone replacement.
Every woman is going to go through menopause, so she might as well understand what the process is, what's going to happen, how we treat it, how we take care of virtually every aspect of it, what it means, what it doesn't mean, what the hormones do, what they don't do. And we find that when our patients can get their arms around the whole subject and really understand menopause and managing their own hormones, it's a much easier situation for the woman. And very frankly, as a healthcare practitioner, it's much easier for us to deal with people that understand exactly what's going on. If you'd like to make an appointment to see us, we're located in West Bloomfield, Michigan, and our information is on the website. We can either see you in consultation to start you on hormones, which generally requires 2 to 3 visits, or we can do that plus take over your gynecologic care, do a pap smear every year, and do all the other things you would need.